discuss an exciting combination of D8 Holdings and Vicarious Surgical. Our discussion this morning will reference presentation materials available in the events section of the investor website for D8 Holdings. Beginning on slide 3, I am joined on the call today by David Steiga, Vicarious' Executive Chairman, Adam Sachs, Co-founder and Chief Executive Officer of Vicarious Surgical, and Bill Kelly, Chief Financial Officer of Vicarious Surgical. Simply stated, we are extremely excited today to announce that D8 Holdings and Vicarious Surgical have entered into definitive business combination agreements. Vicarious Surgical is a next-generation robotics company developing a disruptive technology with the goals of increasing the efficiency of surgical procedures, improving patient outcomes, and reducing healthcare costs. Now, as a SPAC-sponsored private equity investor, I generally focus on identifying companies applying new and innovative technology, targeting large addressable market opportunities. My background is that I was trained as a computer scientist and studied at Carnegie Mellon, which was and continues to be a hotbed of robotics research. In our portfolio, we have incubated a number of biotech and healthcare assets, as well as leveraged robotics extensively to automate labor-intensive manufacturing. So suffice it to say, we are not only believers in the potential of robotics in the future, we're active users of robotics today. So why Vicarious Surgical? Well, we have prepared a short video introducing the company, which I think will help illustrate why we're so excited by this opportunity.
At Vicarious Surgical, we are connecting advanced miniature robotics, computer science, and 3D visualization to build a new category of intelligent and affordable single-incision surgical robots. Miniaturization is part of our core philosophy, and that starts with just one small incision. The entire Vicarious robot fits into the patient's abdomen through a single port. Once inserted, the miniature camera and arms are precisely configured for surgeon control. Standard laparoscopic tools are straight with limited dexterity. Some robotic tools improve upon this by adding wrists. Vicarious instruments redefine robotic motion with fully articulating wrists, elbows, and shoulders. Movement feels natural while providing precise control and the unique ability to grasp or dissect using any surgical approach. This advanced design enables the robot to rotate and reorient in any direction. This gives surgeons the unprecedented ability to work downward, sideways, as well as up, and even backward relative to the incision site. With just one simple incision to open and close, Vicarious streamlines trocar placement and accelerates procedures. The Vicarious robot can approach the same target from any angle with trocar-centered motion. This multi-axis motion capability enables the robot to be repositioned anywhere throughout the abdomen. With versatile trocar placement, the entire abdomen is accessible. Vicarious combines its miniaturized ultra-high-definition camera and robotic arms with virtual reality to unlock an unprecedented model of human-computer interaction. Moving the camera is as natural as turning your head. This immersive 3D visualization is paired with precision hand controllers designed to mimic open instruments with nearly weightless ergonomic control. The result is a user experience where the surgeon feels transported inside the patient. The Vicarious system has just two parts, the versatile robotic pedestal and the VR console featuring an ancillary display. Both units are compact and portable, taking up less than half the space and cost of existing robotic solutions. This efficient system design enables easy access around the patient, improves workflow, and saves valuable OR time. The Vicarious platform is cost-effective and easy to integrate, making it accessible to all operating rooms, community hospitals, and surgical centers. With the system instrumented for advanced sensing, data collection, and artificial intelligence, surgeons will be able to avoid errors, measure anything instantly, and suture automatically, creating a future where everyone has access to the latest surgical innovations. Vicarious Surgical.
Turning to slide 4. As detailed in our press release this morning, this transaction values the combined company at an enterprise value of approximately $1.1 billion and is expected to provide more than $425 million in cash on the balance sheet after closing, including a fully committed $115 million PIPE priced at $10 per share. PIPE participants include strategic investor Beckman Dickinson, one of the largest global medical technology companies in the world, new institutional investors, and existing investors including Bill Gates, Vinod Khosla Ventures, Eric Schmidt's Innovation Endeavors, and Phil Young's E15 Venture Capital. The transaction is expected to deliver up to $460 million of gross proceeds, including up to $345 million of cash held in D8's trust accounts, assuming no redemptions are already effected. The transaction values the combined company at an enterprise value of approximately $1.1 billion and implies approximately 3.1 times 2025 estimated revenues of $355 million. The transaction was unanimously approved by the board of directors of both Vicarious Surgical and D8 and is subject to approval by D8 shareholders and other customary closing conditions. The transaction is expected to close in the third quarter of 2021. Turning to slide 5, the D8 team looked at numerous investment opportunities in search of an exciting growth company, and Vicarious Surgical simply blew us away. Vicarious has a visionary team, backed by savvy investors, and they are disrupting massive addressable markets where legacy solutions are only scratching the surface of what is possible. Adam will discuss Vicarious' differentiated technology and capabilities in a few moments, but it is important to understand that our in-depth diligence process involved external advisors that were equally blown away by the strength and consistency of feedback from surgeons and hospitals alike. We also like the fact that they have a clear path to regulatory clearance and commercialization that has been de-risked by a breakthrough medical device designation from the FDA. We believe Vicarious Surgical is truly a thought leader in the surgical space, and we believe the market is ready for surgical robots that will drive efficiency and improve quality of patient care. We're excited to help Vicarious Surgical with the next phase of commercialization bringing much-needed innovation and choice to patients and practitioners in the U.S. as well as abroad. And with that, I'll now turn the call over to Vicarious Surgical's Executive Chairman, David Syka. David?
Thanks, Donald. Hello, I'm David Syka, and I joined Vicarious Surgical as Executive Chairman last year. I have 30 years' experience as a finance executive for innovative startups, the last 20 years in healthcare. In particular, I spent the last 5 years at RS Health, a company focused on developing next-generation medical robotics platforms, as Chief Financial Officer. RS was founded by Dr. Fred Moll, a leading innovator in surgical robotics, and also the co-founder of Intuitive Surgical in the 1990s. At RS, I worked with Dr. Moll to raise several $100 million in equity capital, build out a development and commercial organization, secure FDA clearance, and commercialize our first platform. It was shortly after that, in early 2019, Johnson & Johnson stepped forward with an offer to acquire RS for upwards of $6 billion, including earnouts, the largest private medical device acquisition in history. Among the things I took away from my experience at RS was a deep understanding of what it takes to develop a robotics platform from concept through commercialization, and also a clear picture of the current landscape of technological innovation in surgical robotics. When Vicarious co-founders Adam Sachs and Sami Khalifa presented me with their vision, I was immediately impressed. The architecture of their robot far exceeded anything I had seen in the last 5 years, adding capabilities currently not available in surgical robotics. In fact, this design solves many of the problems that have vexed legacy robotic systems for the last 20 years. It is, in short, a totally disruptive technology that has the opportunity to vastly improve medical procedure outcomes. Adam and Sami have built an incredible team, both on the development and operation side. And with the addition of Bill Kelly as CFO, who's on this call, and June Morris as Chief Legal Officer, we are well positioned to be a public company. Let me say that it is my great pleasure to be part of this team. With that, let me turn it over to co-founder and CEO Adam Sachs. Adam?
Thanks, David. Let me start with a little color on my background and the company's history and the leadership team that we built over the last 7 years. My background is best described as I'm a roboticist. Actually, a robotics and mechanical engineer and biomedical engineer. I studied at MIT, where I met Vicarious Surgical's co-founder and chief technology officer, Sami Khalifa, who was studying both robotics and biomedical engineering as well. We both worked at Apple for a little while before leaving to pursue our real passion, which was to create this product and this company, along with our third co-founder and chief medical officer, Dr. Barry Green. Dr. Green is a highly experienced, minimally invasive surgeon, specifically a board-certified bariatric and general surgeon, with over 25 years experience in performing advanced laparoscopic surgical procedures. Since then, I'm proud to have built an incredible team of professionals with a breadth and depth of experience, including public company leadership experiences, as well as, importantly, those who have a valuable combination of robotics expertise with medical device experience. On slide 8, the company has been incredibly fortunate to have the support of some of the most well-regarded and visionary investors in the world, including Bill Gates, Samir Kaul and Vinod Khosla from Khosla Ventures, Eric Schmidt's Innovation Endeavor, Jerry Yang's Ame Cloud Ventures, and Phil Young's E15 VC. We are also supported by an impressive group of experienced directors, led by our Executive Chairman David Syka, as well as key strategic advisors, including our technology advisor Paul Hermes, who is the former head of Medtronic's robotics program, and our IP advisor Dave Hyatt, who is former general counsel and chief IP counsel at Becton Dickinson. Turning now to slides 9 and 10. Vicarious Surgical's novel approach to use surgery uses a combination of proprietary human-like surgical robots and virtual reality to transport surgeons inside the patient when performing minimally invasive surgery. Before we dive into our solution, however, I think it's important to outline the problem that was the basis for us forming a company 7 years ago, specifically to solve the long-standing and persistent issues presented by open surgery, standard minimally invasive surgery, and legacy robotic surgery. So this is the state of surgery today. Beginning with open surgery, which is the longest tenured of the approaches that we will discuss today, despite numerous issues. In open surgery, a surgeon takes a scalpel and makes a huge incision across the abdominal wall of the patient to open them up, hence the name. The large incision allows them to work with their own hands and see with their own eyes. However, the large incision also opens the door for accessible pain and possible injuries and complications. In fact, most of the complications from open surgery are not related to the damage to the organs themselves. Rather, they are the result of the large incision made to access the organs inside the abdomen. Unfortunately, almost 20% of patients that have an open abdominal procedure end up with a failure of the incision to heal, called an incisional hernia, that needs to be repaired with an additional surgical procedure. So in an effort to avoid the challenges of open surgery, the industry invented minimally invasive approaches, beginning in the 80s. With minimally invasive surgery, surgeon makes 3 to 5 small incisions up to 1.5 centimeters in length and inserts long, slender instruments through those incisions. With motion that pivots about the abdominal wall, the surgeon can triangulate on the tissue where they want to operate inside the abdomen. Single-port robotic offerings were introduced in an effort to resolve the challenges caused by triangulating between multiple small incisions. Single-port robotic offerings were introduced in an effort to reduce the challenges from multi-port surgery caused by triangulation between multiple incisions. However, as they were built on legacy technology, they have profound limitations, including at minimum a 2.5 centimeter length incision with complication rates approaching 10%, very little force capability, limited motion, and even higher costs than multi-port robotics. So where does this leave us after 2 decades of robotic surgery and 4 decades of minimally invasive surgery? And the answer is, unfortunately, mostly with open surgery. Within the procedure categories that are addressed by legacy surgical robotics, representing about 39 million abdominal soft tissue procedures worldwide, more than 50% are still performed using open surgical techniques today. On slide 11, there are a number of reasons that open surgery represents more than half of these procedures, including that existing systems are very high cost and difficult to use. Roughly 100 procedures are required to become proficient on a legacy surgical robot. They have limited capabilities, and many result in higher, not lower, complication rates. They have large footprints, limited portability, and require extensive setup and higher OR turnover time. All of these challenges result in low utilization. Specifically, only 3.2% of the 39 million abdominal soft tissue procedures worldwide per year are performed with legacy robotic systems. Turning to slides 12 and 14. So let me introduce you to the Vicarious surgical solution to these problems, a robotic solution that is minimally invasive and more capable. Our system has 2 arms and a camera. The arms have degrees of freedom that naturally mimic the motion of the surgeon. The camera pans and tilts and rolls following the motion of the surgeon's head. Each arm has 9 degrees of freedom, effectively giving each arm wrists, elbows, and shoulders. And it all fits into a single 1.5 centimeter incision. You can see on the image on the slide, which shows the size of a 1.5 centimeter incision, and our entire robot enters the abdomen through that trocar size. This is a key differentiator versus legacy robotic systems and allows us to achieve the superior motion capabilities inside the patient. On slide 15, once inside the abdomen, each arm has 9 degrees of freedom, which is not a coincidence. It naturally replicates a surgeon's arm motion, but it does so inside the abdomen. This gives us the ability to not only turn left and right, but also to work up, down, and even back at the incision site, allowing the surgeon to spin around and work basically anywhere from the same single incision point. While inside the patient, the robot utilizes its 28 sensors on each arm to deftly move around the interior of the patient and avoid creating tertiary injuries. The surgeon is able to see everything they are working on as the system provides a natural view in any and all directions, 360 degrees, for a fully immersive experience. Finally, our system is simple, portable, and capable. The Vicarious surgical system fits through a standard door, is only 2 pieces that can be set up easily, can be wheeled from operating room to operating room, no longer requiring a dedicated OR or construction build-out, and can be stored anywhere that the hospital stores surgical equipment. On slide 17, as I said, our system offers surgeons incredible versatility once inside the abdomen. The 9 decoupled actuators in each arm provide unprecedented dexterity through an ultra-thin support tube. And on slide 18, this incredible versatility comes with sensing and visualization to match. With everyone else in the industry focused on chip on a stick, all legacy systems have only sensing where they operate within a tiny cone of space directly in front of the instrument. Our system, in contrast, has 3D depth mapping, full motion tracking, force sensing and feedback at every joint, 4K video at a high frame rate. All of these features allow us to offer incredible feedback to the surgeon during the procedure while also collecting data, which gives us a huge advantage versus our competitors. On slide 19, lastly, the economics of our robotic system are extremely compelling. Advanced engineering enables the sterile portion of our device to be fully disposable with a competitive cost structure. Our decoupled actuators enable polymer cables and parts, reducing manufacturing costs versus traditional manufacturing by over 5 to 10 times. The capital equipment, which is primarily non-robotic, as opposed to legacy robotic systems where they have 4 giant, high-performance robotic arms outside of the patient, our system, the robotic motion happens inside the patient with what you see here on the slide. It makes our cost of goods of the capital equipment significantly lower than competing products. On slide 20, we have been extremely pleased with the positive feedback from surgeons and hospitals alike. Most importantly, our system addresses the key areas that hospitals identified as most important with our core and patented technology. On slide 21, we scored 4.8 out of 5, with 5 being a very easy sell in an independent blinded study with surgeons and hospitals run by one of the leading industry market research firms. On slide 22, we are also very proud of the recognition from the FDA. Our product is the only full surgical robotics platform to receive a breakthrough designation from the FDA, indicating that they agree with our product's potential for clinical benefit. The breakthrough status includes prioritized review, and most importantly, comes with a well-established pathway to reimbursement and coverage. Specifically, the Centers for Medicare and Medicaid Services provide a, quote, unfettered path to coverage, beginning as soon as the same day as FDA market authorization for breakthrough devices. This path accelerates coverage, coding, and payment for innovative technology. The CMS coverage will last up to 4 years from the date of FDA market authorization. On slide 24, we have a multi-phase strategy for development, clearance, and commercialization in the coming years, and we expect steady news flow as we achieve these milestones. On slide 25, our regulatory strategy minimizes time to market while also reducing regulatory risk by adopting a phased and scalable approach. We are pursuing 510K clearance for our first clinical indication in ventral hernia repair, and we plan to quickly expand the number of 510K clearances in new clinical indications in the following years. On slides 26 and 27, ventral hernia is the first clinical indication we are pursuing, and it represents a strong entry point into the broader abdominal surgery market. There are more than 900,000 ventral hernia cases each year in the United States and another 3.3 million in international markets. Most of these are performed with what we call a simple hernia repair, and the outcomes are relatively poor. 1 in 5 of these patients ends up with a recurrence of their hernia within 3 years, which requires a return to the operating room to have it surgically repaired. There are also complex abdominal wall repairs utilizing separation of parts technique, which are much more complicated for the surgeon and take well over twice as long to complete, but result in a much lower complication rate for the patient. roughly 4% versus 20% for simple repairs. Despite the lower complication rate as depicted in the images on the right side of the slide, these procedures are incredibly difficult for legacy robots and can take upwards of 4 hours to perform. Our robotic system's ability to work up and behind itself, tuck and pull down the pouch that needs to be created on either side of the hernia to secure mesh in place, all through one 1.5 centimeter incision, all in comparable times to simple hernia repairs with better outcomes for the patient. All of this means significant cost savings for hospitals and the broader healthcare system as a result of our robotic platform. On slide 28. As I mentioned earlier, ventral hernia is our first indication, but we have many opportunities to expand our clinical applications, and the total addressable market opportunity of the abdominal procedures we are targeting is extremely compelling at an estimated $136 billion. So with that, I'll turn the call over to Bill Kelly, Vicarious Surgical CFO. Bill?
Thanks, Adam. Before I review the financials, let me start with a brief summary of my background. Prior to joining Vicarious, I was CFO of Exosome Diagnostics, where I took the company from development stage to commercial stage and eventually sold the company to Bio-Techne for up to $575 million in 2018. Prior to that, I was CFO of Repligen Corporation, which also went from a development stage therapeutics company to a commercial stage bioprocessing and tools company, realizing a nearly tenfold increase in market cap as a public company over that time period. Prior to that, I was corporate controller at Haemonetics Corporation, a global medical device company. So this is actually my third time as CFO, taking a company from development stage to commercial success, and I've never been more excited with a technology and an opportunity as this one. Clearly, we are excited about this transaction as well, and we believe it could be truly transformative. With this transaction, we believe we can fully fund our final development, get through all of our regulatory and clinical activities on our timeline, and successfully launch commercial operations of this exciting technology and deliver an impressive top line. We are prepared to launch in 2023, and we will do so with a breakthrough designation, as Adam discussed earlier. This is huge in that it offers 4 years reimbursement coverage from day one, which significantly de-risks our early commercialization efforts. Given the compelling market opportunity, our strong competitive advantages that we've talked about, including price, size, functionality, capability, ease of use, fast throughput, as well as the fact that this transaction offers us the ability to fully invest in a strong, successful commercial launch, we believe we will deliver the strong top-line performance that you see on slide 29. On top of that, given the significant cost advantages we have, including the disposability of sterile components and the design of the overall system using processes and technologies that were not available 20 years ago when many legacy robotic systems were being developed. We believe because of these factors, we will deliver a strong gross margin profile as noted on the slide. Our revenues start with systems predominantly, and then as increased clinical applications come online and utilization picks up, the disposables and support components become a greater percentage of our total revenue profile. While our model assumes very modest utilization, we believe adoption will be quite strong, given all the competitive advantages our system offers. That being said, given the size of this market opportunity, with less than a 1% penetration in our addressable market, 5 years after launch and 7 years from today, we are poised to deliver over $1 billion in revenue by 2027. As our installed base grows and surgeons become more familiar with all the competitive advantages that we deliver, what you see is a classic razor blade model with healthy recurring revenue in a very attractive overall market. In summary, what we have is an incredible technology attacking a large, relatively underpenetrated market with huge opportunity for growth and great margins. With this transaction and pipe investment, we believe we are poised to deliver significant value in the years to come. With that, I'll turn it back to Donald and D8 for their perspective on this exciting opportunity. Donald?
Thanks, Bill. So turning to slide 30, we comp Vicarious Surgical against various high-growth medical technology companies and disruptive healthcare technology companies, as well as legacy surgical robotics companies. It's clear to us that surgical robotics have already crossed the chasm for adoption, given that hospital systems no longer have to be convinced that robots deserve space in the operating theater. Now, given the size of the white space and the clear shortcomings of existing legacy robots that Vicarious Surgical Solution solves, with improved patient outcomes and better hospital economics, we have assumed a revenue ramp in 2023 and 2025 that will be quite strong. Importantly, this transaction values Vicarious Surgical on a very attractive multiple of just 3.1 times estimated 2025 revenue. Additionally, we think it's also worth noting that surgical robotic companies have been awarded sizable valuations in the private market, especially when the technology is differentiated and nearing a rapid ramp in commercialization. Turning to slide 31, this transaction values Vicarious Surgical at approximately $1.1 billion, and with cash and trust in the proceeds from the pipe offering, the combined company is expected to have more than $425 million in cash on the balance sheet post-closing. This gives the company the requisite capital to execute their growth strategy to get to commercialization. We truly believe this transaction represents a rare opportunity to invest in a company that has the elements to disrupt the surgical robotics industry and is poised for impressive multi-year growth at an attractive valuation. And with that, operator, I'll turn the call back to you.
Thank you, sir. That does conclude our conference call for today. We do thank you for your participation.